Since there's a great shortage of pediatric nurses, you realize that, I give an example, the districts that do not have not even one pediatric nurse. Look at Kayunga district, I was the only pediatric nurse in the whole district. But we have the pediatric units in Kayunga hospital, and those children are all managed by general nurses, not pediatric nurses.
The high cost of training, it is really very expensive to train a pediatric nurse, because as they come in, one, most of their work is community, and they go to Mulago and spend there 6 months.
The training school is actually good at Sinusoga. We are not supposed to be suffering looking for pediatric nurses.
Actually, as we talk now, it is the only school in Uganda. But as we moved on, other countries started opening up training of pediatric nursing.
But even given the current staffing level that we have, that same number is actually not enough.
We get a certain number, but they are not really too many. Reason being, there were some things that were not being handled. Like before, they were not yet included in the public service structure. But now, I thank the Minister of Health that they've been able to include the pediatric nurses in the public service structure.
We just have a school here that trains pediatric nurses. But where are they? If they are recruited like any other nurse, not in their specialty. Because even the ones I have, they were not recruited as pediatric nurses. They were just recruited as nurses.
The challenge with the low turn-up of pediatric students in Jinja nursing, mainly there has been because of the entry point. There has been an issue of you must have been a diploma nurse before you come and do an advanced diploma in pediatrics. And that is the main thing that people have failed to cope up with, diploma syndrome. So you realize most people go for diploma nursing, after that they go for bachelor's in nursing other than doing the same diploma, which does not give them any promotion. The other challenge we're seeing is sensitization. The ministry has come in and it has helped to adjust on the entry point. Now it has allowed certificate nurses and certificate midwives to join diploma in pediatrics. However, people are not yet aware that that adjustment has been made. We need them to be sensitized about the entry point which has been adjusted on for them to be able to come and join. Currently, we have 250 pediatric nurses who are serving, plus retired. The retired and the ones who are serving, we have 250 in the country. Ideally, when you look at Uganda, it has been roughly made that every pediatric ward is supposed to have 25 pediatric nurses. But as I speak, even if you went to Jinja hospital, you realize you may have 1 or 2 on the ward. So that shows we have a very low number of pediatric nurses.
By training, we only have 4.
The issue of the cost being very expensive, the government needs to come in and maybe fully fund the pediatric students to come and study the course. And then also need to increase on the sensitization that the course has been adjusted on its entry point, that people get to be aware that it's not diploma to diploma, but certificate can make you go and do a diploma in pediatrics.
We divided them to 2 because we have awards where newborn babies are admitted. I put 2 there. We have almost a hospital in Alfenya, which has a pediatric nutrition, pediatric emergency, pediatric OPD, immunization, and a general pediatric ward. It's almost a hospital.
Yes, mostly the northern part of the country is the one pushing most of the students to come and do pediatric nursing. I think for them, they've seen the need for the pediatric practice in the field. Yes.
Then there is also lack of a national pediatric hospital in Jinja. The school is in Jinja, but the students have to go to Mulago. So I would be of the view that if possible, if we get a national pediatric hospital in Jinja, since it is the only institution which is training such pediatric nurses, it would really help to solve this problem.
11 nurses on the general side, meaning those 11 cover emergency, they cover the ward, they cover OPD, the same 11. So the in charge actually, who is a pediatric nurse, has to make sure that when she allocates duty, all units are covered. But we realize that a pediatric hospital houses or accommodates a bigger number of patients overnight, more than the main hospital. During rainy season, it's not a surprise for us to have 300 children admitted. But the 300 children admitted during night and evening, that ward is covered by 2 nurses. Then you can see the straining that these nurses go through and the dissatisfaction our clients have. They can be blamed that they neglected patients. But if you're 2, and you're covering 3 wings of the hospital, sometimes they end up concentrating in emergency room. In pediatric nutrition, I have 7 nurses. So when you put that total, 11 plus 7, that is 18. There is mother-baby care point that has 1 nurse being supported by volunteers under HIV care. So that one makes them now 19. For Northfenya, there are also 2. Those 2, one is in the pediatric nutrition ward. The other one now manages OPD, emergency, and general ward in pediatrics, including supervising immunization, mother-baby care point. So because they are few, they cannot cover all the shifts of nurses. Nurses are comprehensively trained, so they can handle. But of course, when you have someone with a specialty, the outcomes are different.